Have you ever wondered what erectile dysfunction really is? Well, let's break it down. Erectile dysfunction, often abbreviated as ED, is essentially the inability to get or maintain an erection that's firm enough for sexual intercourse. While it may seem like a solitary issue, you'd be surprised to know just how common it is. It's a condition that affects many men, particularly those aged between 40 and 70. But remember, it's not exclusive to this age range and can occur at any age. ED is not a reflection of one's manhood or worth, but a health condition that can be triggered by various factors. It's crucial to understand that there's no need to feel embarrassment or shame if you're dealing with this. After all, it's a part of life for many, and just like other health issues, it needs to be addressed and not ignored. So don't let any societal stigma hold you back from understanding this condition and seeking help if needed. Remember, it's a common issue and nothing to be ashamed of. Let's dive deeper into this topic. So, what causes erectile dysfunction? Erectile dysfunction, or ED as it's commonly known, is a complex condition that can be brought about by various factors. It's not just a mental issue as many might think, but a multifactorial one. One of the major causes can be conditions affecting the blood vessels. These are the highways that transport blood to the penis, and any issues here can result in ED. Similarly, neurological conditions can also lead to this issue. The brain is the command center for sexual arousal, and any disruption in its communication with the penis can cause ED. Now let's not forget the role of mental health conditions, stress, anxiety, depression. These can all affect a person's ability to achieve or maintain an erection. In addition to these, physical injuries, particularly those affecting the pelvic area or spinal cord, can be culprits too. Certain medications are also known to cause ED. These include some blood pressure drugs, antidepressants, and medications for Parkinson's disease. Lastly, substance use, including alcohol and recreational drugs, can lead to ED. So, you see, it's not just one thing that leads to erectile dysfunction, it's often a combination of factors. What are the signs that one may have erectile dysfunction? This question often arises in the minds of many. The primary symptom of erectile dysfunction, commonly known as ED, is difficulty in getting or maintaining an erection. This problem might occur consistently or intermittently, and it's not unusual for it to increase with age. However, it's essential to note that occasional trouble with maintaining an erection is not necessarily a cause for concern. It becomes a matter of concern when it's an ongoing issue, affecting one's self-confidence or causing stress in relationships. So how is erectile dysfunction diagnosed? A healthcare provider can diagnose ED through a comprehensive review of medical history, a physical exam, and possibly tests. This examination typically includes questions about your health, any medications you're taking, and your lifestyle. The healthcare provider might also conduct physical examinations to check for any underlying conditions contributing to ED. If you're experiencing these symptoms, it's important to speak to a healthcare provider. Don't let embarrassment keep you from seeking help. Remember, erectile dysfunction is a common and treatable condition. But what can be done if you have erectile dysfunction, you might be asking? Well, the good news is, there are several treatment options available. Lifestyle changes, like maintaining a healthy diet, exercising regularly, and quitting smoking, can make a significant difference. Medications can also be prescribed, which help increase blood flow to the penis, facilitating an erection. Therapy, both individual and couples, can be beneficial, especially when the cause of erectile dysfunction is psychological. In some cases, medical procedures may be necessary. These could include penile implants or vascular reconstruction. It's important to remember that every case is unique, so what works for one person might not work for another. That's why open communication with your healthcare provider is crucial. Having a supportive partner can make this journey less daunting. They can be there for you emotionally and help you navigate through your treatment options. Erectile dysfunction can have emotional effects, but remember, it's a treatable condition and does not reflect your worth as a person.